15 years ago, at the age of 17, Charissa Perez underwent a life-saving heart surgery through Rotary Club Belize and the Gift of Life Belize.
I was diagnosed with what is called central supraventricular tachycardia. Tachycardia means the heart is beating too fast. So my symptoms were your heart's supposed to beat when you're calm between 60 to 100 beats per minute. I was hitting 300. Wow. So I would have sensations here. I'd have feeling faint, feeling discomfort, wanting to use the bathroom, wanting to vomit, pain in my arm. So it was very obvious. And the symptoms, when it started, was one every year. Then it became so often that it was once a week. Laughing caused an attack, being mad caused an attack, being happy caused an attack, being scared caused an attack. So it was so bad that I had to get treated.
That is when American pediatric nurse practitioner Heidi Hess met Charissa. Hess was on a mission with the Rotary Club Belize to diagnose children suffering from congenital heart disease.
When we find a patient who has supraventricular tachycardia, a long name, tachycardia meaning too fast. So we have to take the patient into the hospital and bring them into a special room called a cath lab. And there we have some very complicated computers that actually do a mapping of her heart. So they have to cause the heart to go into the bad rhythm. So then they can map it and see where the wrong circuit, kind of think of like a short circuit of wiring, and you want to stop it from going the wrong way.
Hess has been returning to Belize to serve since. Charissa now gives back to her community through the organization.
I'm able to have a normal life. You know, I could play, I could have fun, I could exercise, I could walk, I could exert my heart, something that I was not able to do. Something as simple as laughing would cause my palpitations to start. So being able to laugh, being able to be mad, to cry, to be happy, it's insane that simple things like that I couldn't be able to do. So, yes.
So you've gotten a new lease on laughter.
Definitely, and I take advantage of it.
1 in 100 children suffers from congenital heart disease. Two of the most common forms identified in Belize over the years are ventricular septal defect, also known as a hole in the heart, and heart valve problems. Some cases may be mild and may not require surgery. Pediatric cardiologist Dr. Gul Dadlani shared a couple symptoms.
We have some cases where we're able to tell parents your baby will be able to live a nice, long, healthy life, and they're very excited. Others, sometimes we have to tell them bad news where they have a bad form of congenital heart disease that can't be repaired as well too. For all families, we recommend your child be seen by your pediatrician. If your pediatrician or family doctor hears a heart murmur, or if you're a baby and you have cyanosis, which is blueness around the lips, fast breathing, poor feeding, those can be heart-related symptoms in infants. If you're an older child and you have your chest pain or your fast heart rate, those can also be heart-related signs and symptoms to kind of look out for.
Reporting for News 5, I am Paul Lopez.